best treatment for Achilles tendonitis or tendinopathy is a combination of relative rest and strength training. Now, in this video, we're going to look at specifically at strength training. We're going to look at why do you need it? What benefits do you get? What exercises do you need to be doing for your strength training? Then also, how can you adapt them? Because each person's exercise program has to be specifically adapted for them. And there are quite a few variables involved there. Then we'll look at when you start adding weight. How do you go about it? How do you decide what you start on? How much weight should you progress with? And what is your eventual end goal really? Then we'll also look at how can you tell when you've done enough rehab to go back to your sport? And lastly, we'll look at maintenance. Is it necessary to do maintenance exercises? And if you do them, how should you manage them throughout your year? For those of you who don't know me, my name is Maryke. I'm one of the physiotherapists from treatmyachilles.com, where you can get online physiotherapy assessment as well as treatment for your Achilles injuries. Have a look at the description of this video if you want a link to our website. So what are the benefits of doing exercises for Achilles tendonitis? Well, it benefits your injury in three ways. First, it can decrease your pain. Why does it do that? Because it helps to improve your circulation. So whenever a part of the tendon is injured, that area will create more chemicals that can irritate the nerve endings. If you sat still for a period of time, your circulation decreases and the chemicals accumulate and it becomes more painful and sensitive. That's part of the reason why it can be so uncomfortable to walk first thing in the morning. As you get going or you do your exercises, the chemicals then, your circulation improves, so the chemicals are reduced and it becomes less painful. Second, it can also help reduce that stiff and uncomfortable feeling you feel. Basically through the same mechanism. Because when the tendon is injured, the collagen fibers that make up the tendon are moved slightly apart and you've got more fluid that accumulates between those collagen fibers. Now, if you sat still for a period of time, circulation decreases, fluid accumulates, and it can feel really stiff when you get going. But then as you move, the circulation improves and the fluid body gets rid of that extra fluid and it starts to feel more comfortable again. Unfortunately, if you just do gentle movements and you just keep it at that level, this cycle will just continue to repeat. So of course you've also got to do something to actually then bring about healing, that this can become a permanent state of being better. And that's the third thing that strength training exercises can do for you. They can actually help to rebuild and strengthen the tendon. So whenever it's injured, if you look at that part under a microscope, you'll see whereas usually the collagen fibers are nice and packed together, in that area it can be jacked apart, that there's more fluid between it. It can even be quite disorganized and you lose some strength in that area. Now, strength training can actually help to produce new, strong, healthy collagen fibers. It can also help to realign them in the position that they should be pointing. And it can also help to strengthen the rest of the tendon, so that in the end, you get a nice robust tendon that can now again cope with all the activities you want to be doing. When you think about it, it really makes sense that an exercise program for an injury like Achilles tendonitis has to be individualized. Because first of all, nobody's injury is exactly the same as the next person. It will vary with regards to how strong your tendon is. It will vary with regards to how much the tendon is affected. Also just how sensitive the tendon is, because sometimes people can have a lot of pain and a tendon that can become really painful without actually having much damage and still having a strong tendon. So you have to look at that part to individualize it. But also, people recover at different rates. Our genetics is different. We may be on medications that affects it. It may also be that just because I'm older or I'm in the menopause, that makes me heal more slowly. So that's important to think about. And then, of course, lastly, it depends on what activities you want to get back to. Because a program that gets you back to running or jumping sports will look very different from a program that gets you back to just walking and doing daily activities. So there's plenty of things to think about, and I'll be discussing them all in the sections that follow. The most commonly used exercise for treating Achilles tendonitis or tendinopathy are calf raises, also known as heel raise exercises. And it's basically where you go up on the tip of your toes and slowly back down. And there's plenty of different ways to do them in. Now, why are we doing calf exercises if we want to be treating the Achilles tendon? That's because actually the calf muscles and the Achilles tendon forms one unit. The Achilles tendon is what attaches your calf muscles, your soleus and your gastrocnemius muscle, to your heel bone. And it's when those muscles contract that they pull on the tendon and that you can move forwards. So you can't train the one without affecting the other one. There are four main ways in which you can adapt your calf raise exercises. And within each of these, there's plenty of ways to adapt them as well. So let's focus on the four main ones. The first thing is you can either do them with your knees straight or with your knees bent. Now, why would you bother to differentiate? So because your calf muscles, your soleus and your gastrocnemius, attaches in different parts of your legs. So the gastroc attaches above the knee joint. So when you do your calf raises with a straight knee, the gastroc works hardest. But when you bend your knee, you put the gastrocnemius muscle in a shortened position. So then it can't work that hard. So then you work your soleus muscle, the lower portion of the calf muscle, harder. Now, in most cases of Achilles tendinopathy, doing calf raises with your knee straight is enough to get the job done. But there are certain instances where it's not enough, where you want to be adding in exercise that specifically targets the soleus muscle. What I will say is if you have insertional Achilles tendonitis or tendinopathy, where it's the portion that attaches to the heel that's painful, doing your bent knee calf raises in standing can be really provocative and cause a lot more pain because it stretches that area and compresses it more over the heel bone. So an option for that would be to train the soleus while sitting down, and even placing a bit of a wedge or something under your heel that you don't get your heel all the way flat to the floor when you do them. Also, if you have a knee that's a bit iffy, especially your kneecap, doing the bent knee heel raises and standing can really irritate the kneecap sometimes. So it may not be an option for you then. But that's the main difference between doing the bent knee or straight knee, and your physio will decide what's the best option for you depending on your assessment. You can also individualize exercises with regards to the type of muscle contraction. Now, there are four main ways in which you can do this. The first is you can use isometric contractions. So that's when you go up on your tiptoes and you just hold the contraction for a set number of seconds. Why would you want to use this? So sometimes it can be a really painful tendon and it doesn't really tolerate exercise where you go up and down on your tiptoes. And in those cases, sometimes isometrics can be really useful. They don't work for everybody, but they do work for some. So it's something that can be tried. Also, some patients are just not strong enough to actually do the up and down movement fully, especially not on one leg. And then doing isometrics can be a good way to get that base strength you need to start doing the up and down movements. Again, there's plenty of ways to do isometrics in, and it's going to be the way you do them has to suit your tendon. So for instance, you can do it on double legs. You can do it double legs with extra weight. You can do it on a single leg. You can do it on a single leg with extra weight. And how you do them will depend on how strong your tendon is and how much your pain response that you get from that. Because we don't want your pain to increase after you've done these exercises. Then the second way in which you can use muscle contractions is you can do eccentric only exercises or eccentric dominant exercises. Now, an eccentric contraction is when a muscle lengthens as it contracts. So an example for that in the bicep is, for instance, can you see if I do a fist and I slowly lower my arm down, my bicep muscle is contracting, but it's actually having to lengthen as it does that. For the calf raise exercise, that's the equivalent of slowly lowering yourself down. So the calf has to contract to not just let you boom down, but it has to slowly control it and lengthen as it contracts. Now, an eccentric only exercise is when you don't really work the muscle on the way up where it contracts and it shortens, but you focus on that downwards movement and really loads it heaviest during that part. So the typical Alfredson method is an example of an eccentric program for Achilles tendinopathy. So for that, you go up on two legs, remove the one leg, and then slowly lower down, doing the whole movement just on one leg. So you're not really working hard going up, you're doing all the work as you're coming down. These type of exercises have been shown to be effective for treating Achilles tendonitis. These days, we tend to not use them so much because they only train one part of the muscle action. They don't actually train the upwards as well. And to be honest, all movement uses the up and down movement. It can also be quite provocative. So it can cause more pain than what you get with either the isometrics or isotonics, which we'll talk about in a minute. So for somebody with a really sensitive tendon, the eccentric only program can often cause a lot of pain for them as well. Now, does this mean we never use it? Absolutely not. There are cases where we assess a patient and go, you know what, we really need to develop heavy strength in that eccentric phase for you. So let's focus on that. But like I said, it won't necessarily be our first choice for everybody. Then we get to isotonic exercises. Now, I know it can sound confusing with isometric, but isotonic combines both types of movement. It combines the concentric, where if I can use the bicep again, I contract the bicep, it shortens, concentric movement, and then I let it lengthen as I lower down. So for the calf, it combines both the lifting up and the lowering down action to strengthen the calf and the Achilles tendon. We prefer using isotonic exercises because they resemble our normal movement and function during running and walking and jumping more closely. Also, there is good evidence that doing heavy, slow resistance training using both the up and down motion can help for Achilles tendonitis and is less likely to cause discomfort than the eccentric only program. So they are definitely useful to use, and in most cases we'll try to get you onto that type of movement as quickly as possible. Then the fourth type of movement is plyometric exercises, or exercises where you have strong, forceful contractions, and they also combine both the up and the down movement, so the concentric and eccentric, but the difference is it's much faster and more forceful exercises. Now, these are really useful if you do sports that require that type of movement. So if you're a runner or you're somebody who plays a sport that does jumping activities, you need to be including that in your final stage of rehab. So what are the benefits of them? They've been shown to develop the tendon's ability to work like a spring. So when we run and jump, the Achilles tendon is meant to store the energy and release the energy really quickly. And although there's evidence that slow resistance training can restore that function, not everybody's tendons will regain that function just by doing strength training. So for some people, you need to add that in to regain that strength. So it's a very useful thing to add, but it has to be towards the end of your training rehab sessions, and also only if it's needed for your sport. The third way in which you can individualize exercises is the speed you do them at. Now, the speed will depend on the goal of the session. If your goal is to really focus on gaining strength in your tendon, then doing high load exercises with extra weight and slow contractions have been shown to produce better tendon strength. What do I mean with slow? I mean you should take at least 3 seconds to lift all the way up and 3 seconds to come all the way down. In some research studies, they even use 6 seconds up and 6 seconds down. But to be honest, that feels as if I'm wasting my life. So 3 seconds up, 3 seconds down, we find is more than enough when you're aiming for strength in your tendon. Then the second goal can be to develop your motor control. So there's evidence that when we have an injured part of our body, our brains start to think differently about that part and is not able to control it that well. If we think of the Achilles tendon, I don't know if you've noticed when you try to slow your exercises down that you get quite a bit of a shake. That's often a sign that your motor control isn't quite what it should be. Now, the research has shown you can easily restore your motor control, again, if you focus on the exercises while you're doing it. So they did a study where they looked at if people just do their exercises, think about what food they want to do, they don't really focus on what they're doing, versus when they do them, where they really focus on how am I doing this? Let me see if I can stop it in the halfway of the movement, then go again and really control it, force my brain basically to connect to that part of my body. And what they found was, yeah, If they do it in that second way, the motor control was restored. If they did it in the first way, it was restored for some people, but not for all. So there's real double value in doing exercises slowly and concentrating on how your foot is moving while you're doing it. Then third goal is, do you want to be developing that fast contraction and that stretch shortening cycle, so that spring-like properties of the Achilles tendon? If you want to do that, then you have to do exercises that uses explosive movements or fast movements under high load. Now, it can be bounding exercises where you just have heavy loads on and you do the exercises quite quickly, or it can be also plyometric exercises where you don't even use extra weight, but you use things like hops or jumps. And the hops and jumps can again be taken from double leg, not very high is easier than single leg, for instance, and very high is much harder work as well. So usually for a plyometric program, we'll also start with the easy stuff and then progress through a few weeks until the person reaches the high level stuff and they're okay with that. The final adaptation I want to talk about is whether you do your exercises over a step or just to floor level. Now, why does this matter? Well, because sometimes doing them over a step can make your pain worse, and other times it can actually be the thing that's missing that stops you from progressing. So let's discuss that a bit more. If you have an insertional Achilles tendonitis, so where it's painful at the heel where it attaches or just above the heel, then doing them over a step can really make your pain feel worse. And the reason for this is insertional Achilles tendonitis is really sensitive to anything that stretches or compresses the tendon in that area. And as you drop your heel down over the side of the step, that's exactly what happens there. So for insertional Achilles tendonitis, especially during the early stage of rehab, it's best to just do it to floor level. However, mid-portion Achilles tendonitis actually reacts better to the exercise if you can do them over a step. Now, during the early stage, it may be a little bit sensitive and you may start doing them on the floor, but your physio will usually move you on to doing them over the side of a step as soon as possible, purely because you see better results with the mid-portion guys. Now, if you want more information about how to treat insertional Achilles tendonitis specifically, have a look at the description of this video. I've put a link to a video I've done about that. If you've done any research about Achilles tendonitis on the internet, you will know by now that you have to add weight to your exercises to eventually get the Achilles strong enough for what you want to do. Why is this needed? Well, because there's studies out there to show that when we run, forces of between 6 to 8 times our body weight goes through our Achilles tendon. And that's because it's not just your body weight that you're carrying, but also the speed at which you load the tendon that affects the size of the force. And the same goes for fast walking or jumping. They all have multiples of body weight forces that goes through the tendon. Now, of course, the activity you want to get back to will determine what weight you've got to work up to eventually. And also, you can't start with a heavy weight right from the beginning, because it may actually make your injury feel worse. So the big question is, what do you start with? How do you increase it over time that you don't actually make your pain worse? And then finally, how do you know you've done enough? So let's discuss those. So how do you know where to start? How much weight can you add? Well, the things we want to understand to answer that question is, how strong is your tendon at this moment? And also, how irritated is it? Because these two things are often not matched. You can have a really strong tendon, but it can be really sensitive. So it doesn't matter if you do exercise that's quite easy, it can still make it flare up. So we need to gauge that. But then you can also have a tendon that's not that painful, but it's really not very strong. So we've got to look at strength tests, but we also have to look at how the tendon reacts with regards to pain. And from a practical point of view, how we do this when we test you is we tend to start with what we think will be the easiest thing for you. So something that's easier than what we expect you to be able to do. And we can tell what that will be through listening to the things you tell us makes it hurt, what you've been doing in the last few days, what you perhaps have been doing up until this stage. So classically, we'll get you to do double leg heel raises with absolutely no weight, just to see quality of movement, how comfortable is it, everything like that. And then we may ramp it up. So single leg ones, even extra weight, Perhaps we even get you to jump. It all depends on the person in front of us. Now, it's important not to just look at while you're doing those exercises how it feels, because tendons have a way of only hurting 24 hours afterwards. So you have to check your 24-hour response to that exercise as well to understand how sensitive your tendon is. To give an example, it's usually okay if you feel some discomfort while you're doing the exercise, as long as you won't really class it as pain. But then it shouldn't increase your pain that you normally feel significantly in the 24 hours afterwards, and it should really be calmed down back to your normal levels by the next day. If you find that actually, no, the next morning it's a lot more uncomfortable and it's just not happy, it means whatever you tested yesterday was too much, and the next time you do it, it's got to be gentler than that. And it can be that it was too many repetitions, it can be that it was too much weight for it, or just not the right type of exercise. So it's important to check that cycle. Okay, so now you've established what you can do and how much weight you can use. How do you safely increase the weight over time? I find it's best, because you can get this delayed pain response, that you don't go in large increments. So when we think of weight, obviously if I pick up 5 kilos versus a big strong guy picks up 5 kilos, that weight will mean something different for each of us because our strength is different. Now, what I tend to find, if somebody is a larger person, so like I'm quite tall, I'm 175 centimeters tall, for me 3 kilos isn't that much. If you've got a teeny tiny person who's perhaps just 150 centimeters tall, then 3 kilos can be quite a lot for them. So 2 kilos may be enough to increase. So I usually get my patients to only increase weight if they've already done 2 training sessions with that specific weight on the full number of reps that I've advised them to do, and it's felt quite easy and the pain response was okay. Then they can increase it by 2 or 3 kilos. But the first session with a higher weight, I get them to decrease the number of repetitions again, even if it feels easy. And this is just because we want to check what the delayed pain response is. Pain response is fine, then they can start adding more reps until they get to do it with that maximum number that I've set them. It can be 3 sets of 15 with a specific weight. Do that in 2 sessions, no issue, they can increase it again. Now, the third thing that's important here is to not rush your exercises. Yes, we give you targets to work towards and what weights we want you to achieve before we can move on to certain things. But the problem with the tendon is it needs a certain number of weeks to rebuild, and you can't really rush that. So every time you do a training session, you get this cycle of, you get a little bit of micro damage in the tendon repairs it, and then it's a little bit stronger for the next session. So remember, we're trying to repair the area of the tendon that's injured. Now, collagen fibers take a very long time to change structure and repair. So it's not just about reaching that goal weight. It also is about how many weeks of strength training you do. And in general, I find that it takes at least 12 weeks of progressive strength training, but in most cases it takes more, something like 4 months to 6 months and even longer. If you've had your tendon injury for about a year or longer, it will likely take a year for you to get yourself back to full running without pain as well. So that's something to keep in mind. And the reason I'm pointing this out is I've had a few patients who's been really determined and they've gained strength quite quickly, but the tendon sensitivity didn't keep up with that. So then they cause themselves more pain because they keep on pushing the weights in each session because they feel they can increase it, but it's not useful because they're causing too much pain, and then the pain cycle keeps on going. So it's important to try and be patient with this and not rush the rehab. How often can you do your exercises? Well, this will depend on what exercises you're currently doing. You've got to remember that whenever we do exercise, now whether this is strength training or going for a walk, anything like that, it has an effect on the tissue and it can cause some micro damage. Now, the harder the session or the higher load it is, the more micro damage it causes and the more the body has to repair. So then after your exercise bout, the body goes into repair mode, it repairs this and it repairs it stronger than what it used to be. And this is how we grow stronger. But the repair can only happen if you actually allow it to happen. So if you train before you're fully repaired, then you can actually cause yourself overuse injuries like Achilles tendonitis. So if you're doing low load exercises, then you can do them daily, or you can even do them several times a day, because they don't really cause micro damage or that much. If you're doing high load exercises that really work your tendon and your calf hard, you have to give it about 48 hours of recovery between sessions. So for high load exercises, twice, maybe 3 times a week is more than enough, because otherwise they will be counterproductive. And you've also got to remember that what's high load for one person will be low load for another. So if you're not that fit and you don't really do sports, or your tendon's been sore for a long time and it's been detrained, double leg heel raises may actually be a high load exercise for you, compared to the next person who's been staying active, been running with it, and can do quite a few heel raises. They may find that double leg heel raises is actually a low load exercise and they can do it daily. So it all depends on that. And the other thing you've got to remember is that other things can affect how quickly you recover after exercise. So genetics play a role, but also being older means that you recover more quickly. I wish. Recover more slowly. And also if you're in their menopause, that can affect your recovery. So if that's the case, you've got to take more recovery days between. And it's also not an exact science. So monitor yourself. See, okay, I've given it 2 days of rest, but actually my calf still feels a bit stiff, or my tendon doesn't feel quite recovered yet. Then you have to give it another day. So try to be flexible with your program, and instead of going on, this is what my program says, adjust it according to how your body feels, and you'll get better results in the end. Now, if you want more information about the menopause, I've put links in the description of this video about that. How do you know when you're ready to actually go back to your sport? Well, be careful not to just think, oh, my Achilles doesn't hurt anymore, so I'm going to go for a long run now. Because that's not how it works. The symptoms you feel in your tendon is not reliable, because it can't tell you how strong your tendon is or what your endurance level is. And a good example of that is, say for instance, somebody just rests the tendon for a week or 2. The pain may fully disappear, but nothing has changed strength-wise, and it's one of the most common reasons why the tendon then flares up when they go back to running or the sports they play. So a better way to decide whether you're ready to go back to sport is looking at your rehab. You've got to restore the full strength you need for your sport. So if we think of a runner, you should have gone through heavy strength training. Usually we aim for about using up to 20% extra of your body weight. So I'm 70 kilos, that would be I've got to do my single leg heel raises with about 14 kilos extra. But it depends on the program you work with. There's other types of programs one can use as well. You should also have completed a full plyometric program. So several weeks of plyometric training where it loads it progressively higher and higher and higher. And then you've got to ease back into the running, because it doesn't matter how good your rehab is, it doesn't fully prepare it for the full load of a continuous run. So using something like a run-walk program, where you have intervals of walking in between, can be useful to build that last bit of strength and endurance to get you back to your full running. Same thing for football, for instance. With that, you also want to get back into the changing of direction stuff for the later rehab. Now, if we look at a walker, then you don't need such high forces to go through your tendon. So your strength training will likely only be taken up to about 10% of your body weight, but it depends on the person. And it will definitely, or very likely, not include plyometric training if you don't do any jumping type activities. Because 1, the rest of your body won't be conditioned for it. And 2, you don't need to be doing it because you don't want to be jumping. So when you look at return to sport, don't think about symptoms. Think about what strength and endurance do I actually need for the sport I want to be doing. Now, the last thing I want to talk about is maintenance exercises for preventing the Achilles tendon becoming injured again. And this is important because, 1, there is research to show with general tendinopathies, if you do maintenance exercises, you can prevent the pain from coming back and the tendon from being damaged again. But also, I want you to be careful, because I see 2 ends of the spectrum here. I see the guys who go, oh, tendon is better, I can just leave my exercise and go for it, and then they get injured. But then I also see the other guys who are so worried to stop the rehab exercise because they've now been focused on it for so many weeks or so many months usually, that they end up still doing the high loads of rehab exercises while they're also increasing all their running sports and jumping sports. And then it's too much for the tendon and it gets injured again. So you have to find that sweet spot. So yes, maintenance exercises and calf raises are important, but they have to be tailored to your stage of training throughout the year. So what do I mean with that? Say, for instance, your running volume is really ramping up and your intensity is ramping up. Perhaps you're training for a marathon or you've entered competition track season. The maintenance exercise for the calf raises you do then should only be very small sessions and higher weight usually. So you're doing about 8 rep max and you're doing 3 sets of 8 once a week just to maintain the strength. You may even leave them out fully if you're in a competition phase where you do lots of high intensity running on a weekly basis. But then, as you go into the recovery phase of your year and actually your running volumes decreases or the intensity decreases, then your strength training should be increasing again. So then we're looking at trying to get at least 2 sessions of good strength training in your week to maintain that Achilles tendon and calf complex. If you're just a walker, then actually you can, and you don't have these ebbs and flows, you can maintain your Achilles strength through doing 1 or 2 sessions per week, but also adjusting it. If your calves are already feeling tired, then think about perhaps today is not the day for it. Perhaps wait for a day that I'm feeling a little bit less tired and doing it on those days. So maintenance exercises are important for everybody, but think about what you're doing in the rest of your training and don't just do them on top of that, because then it can actually cause injury. Excellent. Hope you found this useful. Let me know if you've got any questions. And if you need any help with an injury, you're welcome to consult one of the team via video call. Link to the website is in the description of this video. Take care.